Good afternoon in California and good morning in Korea. My name is Hyunmi Park and I am a research professor at the Department of Medical Education at Korea University and a British colorectal surgeon by trade. It is a pleasure to meet you all, albeit online, and I am grateful we are still able to share our scientific knowledge in the middle of this pandemic. I would like to share with you a couple of projects that our medical school has been undertaking within the realms of online education. First, the online international case discussions, and secondly, the development of a Korea-specific interactive virtual reality clinical case platform. From the aforementioned game, the Global Alliance of Medical Excellence team, 3 Asian medical schools have come together. And we have started a pilot program to discuss clinical cases led by faculty from Korea, Japan, and Hong Kong. The medical students who have joined us include the 3 East Asian countries as well as German students. We meet over the Zoom platform fortnightly to discuss clinical cases brought by the faculty who lead the sessions on their own clinical specialty, which in this pilot have included pediatrics, surgery, and internal medicine. The purpose of these meetings are various, but in the current pandemic situation, international clinical exchange programs have all come to a halt, and this will give the students the chance to meet and get to know each other, as well as having the opportunity to discuss clinical cases in English, which is not the first language of any of the students involved. We have grouped the students into 4 or 5, mixing them up according to their extracurricular interests, such as which musical instruments they play. We envisage that there will also be opportunities to discuss different clinical presentations or differential diagnosis depending on the disease prevalence of each country and potentially varying treatment protocols. This was 2 weeks ago when students were discussing the images of a child's chest.
I can start if no one else wants to. So we go A, B, C, D, E for a chest x-ray. So A, looking at the airways with the trachea, it kind of looks like it's a little bit deviated to the right. B, looking at the lung fields, it's kind of hazy opacities. I would almost say like ground glass opacities that Kiara said, and that's kind of confirmed in the CT on the left with like kind of like almost emphysematous, almost like honeycomb quality to it. He doesn't have cardiomegaly, so that's fine. C, D, the diaphragm. It doesn't look like there's much of like a pleural effusion because I can follow the recesses all the way down.
Exactly.
And everything else, I mean, I don't think he's going to have a problem with his bones.
Surin, are you here? Yes, I can see you. So Surin, do you know what does the ATG?
ATG, the anti-thymocyte globulin. I know that it is used with cyclosporin usually.
There is a clear difference between the Western and Eastern students. The Eastern students tend to be a lot more shy, but by being regularly exposed to an array of faces and accents, and by making sure they understand this is a safe place where there is no wrong question or wrong answer, we hope that this platform will encourage them to come out of their shells. So far, the feedback has been very promising. Next, I would like to give you a glimpse of the virtual reality platform that we are developing with a software company. During this pandemic, we have relied heavily on digital content for our lectures so far, and our clinical year students have been lucky as they have been able to continue attending their hospital placements. But we know that this will not be the last epidemic that might disturb future clinical experiences like it has in Europe or medical schools in the States. Therefore, to not only prepare for such public health crisis, but also to cater to the current Generation Z students, our university has embarked in finding the most suitable virtual reality platform to be an adjunct to patient contact. There are already a few companies that provide such clinical cases, but what I have noticed when trialing a handful of them is that there is not only a language barrier, but also a significant cultural and healthcare system difference on how the patients are being portrayed. Therefore, we have decided to develop our own. Similar to already existing products, there will be patients with different presenting complaints of multiple age ranges and backgrounds. They could be presenting to the outpatient clinic or to the emergency department, and after history taking, the patient could be examined with their observations visible on screen. The relevant investigations could be requested by the student, which will then reveal the appropriate images. As we all know, the pandemic has just accelerated the inevitable future of digitalized education, and the current Generation Z have embraced it like ducks to water. Therefore, educators have to catch up and keep up and develop for the sake of our future workforce by developing programs which are interactive, tailor-made, student-centric, but importantly, it has to be valid and reliable so that it can be in the future also be used for formative and summative assessments. Thank you very much for your attention. Please keep safe, and I do hope that we will be able to conduct such conferences by meeting in person in the near future. Goodbye.